Hello parents, welcome to the Janu's world. Hope you all are doing so well. Today I am going to talk about the 5 weeks of a pregnancy in first trimester. Before we start the video, please subscribe to my channel and hit the bell icon to get notifications. Let's get started. 5 weeks pregnant, first trimester. Now you are in the 5th week of the pregnancy, officially 2nd month of the journey. And you have only 35 weeks to go. Week 5 is a common time for moms to find out they are pregnant. That's because by now you have probably realized you have missed your period and did the test at home. Congratulations! Perhaps now you have confirmed your pregnancy. Plus, at 5 weeks pregnant, high hormones levels may be giving you symptoms that are tough to ignore, like sore breast, nausea, and fatigue, and etc. We will talk about them later. If you haven't already confirmed you are pregnant with the urine test, this is the week to do it. Remember, the best time to check is your first pee in the morning, when your levels of pregnancy hormone will be at their highest. Many women don't have their first antenatal appointment until the end of the first trimester. If you do, go to your doctor now. They will be able to work out your baby's due date. The countdown has officially begun. Most doctors start counting pregnancy from the first day of your last period. But there's a thing. While many people think of pregnancy as lasting 9 months, it's really 40 weeks long. If you are counting your weeks to a month, that adds up to 10 months. Of course, some months have 5 weeks. That's why many doctors avoid tracking pregnancy progress simply by week. Although you don't look any different, you are officially in your 2nd month of pregnancy, with only 8 more months to go. Baby development at week 5. Your baby is about the size of a sesame seed, which is 9 millimeters about the size of a little fingernail now. How big is baby at 5 weeks pregnant? At 5 weeks pregnant, baby is the size of an apple seed. Yep, your embryo is now measurable. Though at week 5 of pregnancy, it's 9 millimeters from crown to rump. I mean head to bump. And babies gearing up for much more growth. In fact, in the next week, they all double in size. Grow, baby, grow. Organ development. It might seem early, but your baby is starting to develop major organs like the heart, stomach, liver, and kidneys. Growth is now largely focused on your baby's head, which is beginning to develop much more rapidly than the rest of the tiny body. This is because the brain is undergoing some very crucial and rapid development in order to regulate the heart rate, blood circulation, and other vital functions. Tiny tadpole. Deep in your uterus, your tiny embryo is growing at a furious pace and looks more like a tadpole than a human. Your embryo is now made up of 3 layers: the ectoderm, the mesoderm, and the endoderm, which will later form all the organs and tissues. Brain. Your baby's brain, spinal cord, and nerves from the neural tube, which is starting to develop from the top layer, the ectoderm. This layer will also give rise to skin, hair, nail, mammary and sweat glands and tooth enamel. Heart. The heart and circulatory system begin to form in the middle layer or mesoderm. In this week, in fact, the tiny heart begins to beat and pump blood. The mesoderm will also form your baby's muscles, cartilage, bone, and the tissues under the skin, lungs and gut. The third layer, O, endoderm, will become the lungs, intestines, and early urinary system, as well as the thyroid, liver, and pancreas. In the meantime, the primitive placenta and umbilical cord, which will deliver nourishment and oxygen to your baby, are already on the job. The outer layer of the cushionary amniotic sac develops into the placenta. Its cells grow deep into the wall of your womb, creating a rich blood supply. Your placenta will give your babies nutrition, actually foods, and oxygen through their umbilical cord. It has three vessels, one thick vessel carrying oxygenated blood and nutrition to the baby because babies won't breathe through their lungs until they are born, which is why water births are safe, and two thinner vessels that carry blood containing waste products back to your circulatory system. The placenta is a remarkable lifeline that also keeps bacteria and viruses away from your baby. Human development is crazy. Pregnancy symptoms during week 5. The pregnancy symptoms you feel at week 5 are just the beginning of the slew of changes your body is about to go through. No need to dread the entire pregnancy based on what's happening right now. Many moms to be says the first trimester is the toughest. So think of it as getting the rough stuff out of the way easily. In the meantime, take care of yourself and get plenty of rest, eat right, and figure out ways to help yourself feel better. If you are wondering what to expect at week 5 pregnant, here is what's most common: tender, swollen breast. Morning sickness gets all the attention, but aching breast may actually be the most common symptom at week 5 pregnant. Increased hormone levels boost blood flow, which may make your breast feel swollen, sore, tingly, and unusually sensitive to touch. Breast tenderness can be one of the earliest signs of pregnancy. Morning sickness. This bad boy is so inaccurately named. Nausea and early pregnancy can happen at any time of the day, not just morning. And unfortunately, some pregnant moms feel queasy pretty much all day. In fact, if you are 5 weeks pregnant with twins, you may be more likely to have severe more sickness. Experiment with different strategies to help find what helps you deal with the quickest best. Eating small, frequent meals is one good one. You might also try vitamin B6 ginger capsules, nausea reducing lozenges or lollipops, and acupressure wristbands. Fatigue. At 5 weeks pregnant, it's normal to want to nap in middle of a boarding meeting, a dinner date, pretty much anytime. You are sapped from making a baby and there's not much you can do about it. Expect get some extra rest. Do some light exercise and eat every few hours. No one knows for sure what causes fatigue in early pregnancy, but it's like that hormonal changes are at least partly responsible. Nausea or vomiting. Morning sickness is nausea that can strike at any time of day. It usually starts around 6 weeks of pregnancy, but it can begin as early as 4 weeks. It's likely to ease up with the end of the first trimester. So, women have cramping as well. Frequent urination. You might notice yourself having the urge to pee more often early in pregnancy. The symptoms at 5 weeks pregnant is in part because your kidneys are actually expanding. Wow! Cramps. Around 4 or 5 weeks, cramping could be a sign the embryo has implanted nicely into the lining of your uterus. Or it could be a sign your uterus is expanding and stretching your ligaments. If you are feeling cramping at 5 weeks pregnant, that's severe or painful. Call your doctor and get checked out to make sure it is not a sign of a problem. Spotting. When you are 5 weeks pregnant, spotting can seem scary, but little blood on your underwear could also be a sign of implementation. You might also spot a bit after sex, since your cervix is more sensitive now that you are pregnant. This is totally normal, but if you are having something that's less like spotting and more like bleeding at 5 weeks pregnant, or really if you are concerned at all, call the doctor. No symptoms. Don't worry. Many women don't feel anything yet this week. In fact, most early pregnancy symptoms don't start until next week. Every woman is different and will have her own unique experience of pregnancy. Pregnancy checklist at 5 weeks pregnant. Note your last period. Note down the first day of your last period so your provider can determine your due date, and start making a list of any questions you want to ask at your first prenatal appointment. Make a list of all your medicines. You'll also need a list of all your medications, prescriptions, and over the counter, including supplements, so your provider can help you decide whether they are safe to take it now. Put together a family health history. Take relatives on both sides your family's medical histories. Your provider will want to know whether any chronic condition or genetic abnormalities run in either of your families. Drink plenty of water. Ever wonder how all the good stuff in your parental vitamins and healthy foods you are faithfully consuming every day are shipped to your fetus? It all starts with water, which helps your body absorb essential nutrition into the cells and transports vitamins, minerals, and hormones to the blood cells. It's those nutrition It's those nutrient-rich blood cells that reach the placenta and ultimately your body, all with the help of water. Benefits of staying hydrated: decreases constipation, hemorrhoids, reduces swelling, softens skin, increases energy, keeps you cooler, decreases a risk of urinary tract infection, decreases risk of preterm labor and preterm birth. Your emotional changes this week. You may be feeling a bit teary and prone to emotional meltdowns this week. You could be feeling a whole range of emotions, many of them at the same time: excitement, joy, worry, guilt. This is a big week emotionally, especially if you have been planning to conceive and you find out you are. You are likely to feel unsure about whether to tell your family and friends you are pregnant. The first 12 weeks of pregnancy can be a risk time, and not to all pregnancies counting to term. It's a very personal decision for couples when to share the news with others. Many wait until after the 12th week when the risk of miscarriaging is no greater than 1%. Hints for the week: Remember to take your prenatal vitamins every day. Week 5 is when your baby's neural tube, brain, and spinal cord are open. By next week will be closed. Avoid taking any medications unless they are absolutely necessary and your doctor has given you the permission. Some medicines are harmful to embryonic development. Try to rest when you can. You may be feeling extremely tired, and the best way to deal with this is to sleep and take it easy much as possible. 5-week pregnant bellies. At 5 weeks pregnant, your belly may look unchanged, or you may be a bit bloated or feel like you have already gained a pound. You might feel so sick that you can't eat and worry you could have lost a pound. All those sceneries are considered perfectly normal and totally okay. All pregnant women are different, and now their bodies change throughout pregnancy varies widely. You are probably starting to wonder a bit about overall pregnancy weight gain. The short answer is you don't need to worry too much about it yet. Doctors only recommended gaining few pounds, actually 1 to 5 to be exact, during the first trimester, which ends like after week 30, and that will probably happen without you thinking too much about it. The long answer is that you will need to gain weight during your pregnancy. Here's what the American College of Obstetricians and Gynecologists recommends. If you are underweight, your BMI is under 18.5, your recommended total pregnancy weight gain is 28 to 40 pounds. In the second and third trimesters, aim to gain about a pound per week. If you are normal weight, your BMI is 18.5 to 24.9, your recommended total pregnancy weight gain is 25 to 35 pounds. In the second and third trimesters, aim to gain about a pound or little less per week. If you are overweight, your BMI is 25 to 29.9, your recommended total pregnancy weight gain is 15 to 25 pounds. In the second and third trimesters, aim to gain a little over a half pound per week. If you are obese, your BMI is 30 and above, your recommended total pregnancy weight gain is 11 to 20 pounds. In the second and third trimesters, aim to gain about a half pound per week. If you are 5 weeks pregnant with twins, and starting a normal BMI, your recommended total pregnancy weight gain is 37 to 54 pounds. In the first half of pregnancy, aim to gain about a pound per week. In the second half, gain a little over a pound per week. Wondering if you could be 5 weeks pregnant with twins? If you were, you probably wouldn't know it yet. Though, as we mentioned about, some twin moms where they had worse morning sickness. They also may gain weight more rapidly and start to show early than women having one baby would. 5 weeks pregnant, first ultrasound. You won't necessarily be having your first ultrasound when you're 5 weeks pregnant. In many cases, your doctor will schedule an appointment and ultrasound around week 8 or 9. If there are any risks associated with your pregnancy, you might still get an ultrasound this week. A specialist is able to see the fertilized egg approximately in week 5 of the pregnancy. The heartbeat can be heard in week 6. Usually during pregnancy, an ultrasound is carried out using an abdominal sensor. But during the early pregnancy stages, a doctor can still perform a transvaginal examination. The first ultrasound examination helps to confirm the heartbeat of the fetus and the fact that the pregnancy is not ectopic. Later, it allows you to see the location of the placenta and the umbilical cord, as well as to access the overall condition of the child. Ultrasound enables one to monitor a successful course of pregnancy. 5 weeks pregnant lifestyle. There are several habits that can help you be healthier and more comfortable during the early stages of pregnancy. Start eating a healthier diet. Eating food such as leafy greens, fruits, low mercury fish, lean animal protein, grains and cereal, vegetables and seeds and nuts can help you and your baby stay healthy during your pregnancy. You should be avoid alcohol, tobacco, excessive caffeine, high mercury fish, uncooked meats and unpasteurized dairy. Exercise regularly. It's perfectly safe to exercise during pregnancy. If you are not feeling too tired or nauseous, make some time to build up your endurance and strengthen your muscles. Listen to your body. Creating a baby is hard work. Fatigue is something you can expect on week 5 of pregnancy. So, rest up if you are feeling tired. Find what works for your morning sickness. There are many ways to relieve morning sickness, such as acupressure wristband, ginger capsules, and nausea reducing lozenges. Find what makes you feel better, but don't forget to consult with your doctor first. Avoid traveling in infected areas. Sex at week 5 of pregnancy. It's safe for you to have sex at any stage during your pregnancy. Some women experience an increased sex drive around this stage, but keep in mind that symptoms like morning sickness can put you off sex when you are around 5 weeks pregnant, which is normal. Some women can spot lightly after sex. Some women can spot lightly after having sex. This happens because your cervix has become more tender and vascularized. Unless the spotting doesn't stop, there's nothing to worry about. Warning signs of a miscarriage. Although, according to American College of Obstetricians and Gynecologists, about 10% of pregnancies end in miscarriage. The most common sign of a miscarriage is vaginal bleeding. The bleeding tends to be heavier than spotting, and it may contain clots. You may also have abdominal or pelvic cramps and back pain. Call your doctor if you experience any bleeding during pregnancy. An ectopic or tubal pregnancy is a pregnancy that grows outside of the uterus, most often in the fallopian tube. This type of pregnancy isn't viable and is life-threatening to a mother. Symptoms of an ectopic pregnancy include vaginal bleeding, pelvic pain or cramping, possibly on one side, shoulder pain, and dizziness or fainting. Call your doctor right away if you have symptoms of an ectopic pregnancy. So, parents, that's all for today. Let's meet on our next video. Bye bye.